It's time to get your pet questions answered.
UW veterinarian Sandy Sawchuk is here for her monthly visit, taking your calls at 270-9933. Great
Sandy.
to see you.
Hi, how are you guys?
Great.
How's Dozer doing in
Trying
this
to stay
cold?
warm.
Oh, you know, my dogs are just couch potatoes, and they are very quick when it comes to going outside and coming back in again. But I know you have troubles with your dogs because they don't like to walk anywhere where the salt irritates their feet. They won't wear booties. I had one client say that she sprays the bottom of her dog's feet with Pam. and I'm like, well, I guess it would work. There's a product named Musher's Secret that is a wax that may give a little protection. But booties, that's why they're usually non-returnable. Nobody wants to.
Right. I think we have four or five pairs trying different ones.
Yeah.
And outside dogs, even in this weather, they got to.
They need to have shelter. They need to have water that's in a heated water bowl, elevated off the ground, out of the wind. Yeah, it's. I would be bringing them in, even the the northern breeds that like to be outside when it's below zero. Like
absolutely,
need to be.
It's dangerous out there.
All right, let's get to the phones, and we'll start with Lisa in Madison. Hi, Lisa. What's your question?
Yeah, hi. I have a newly adopted 2-year-old cat, and I'm wondering how to get him used to being brushed.
That can be tough because you usually have to start when they're really little. But what I would be recommending is pair brushing with something that he really, really likes. So if he likes to eat and he likes treats and food, just maybe have the brush present while he's eating his dinner. Then gradually just maybe make one swipe and that's it. And try different grooming tools. Some are more comfortable for cats than others. You may find that a comb works better than a slicker brush, or just experiment with a few things that way, but use food treats. Most cats will then go, wow, okay, I get canned food when I get brushed.
Make the connection.
That's good.
Right.
All right, let's go to Kathy in Middleton. Hi, Kathy.
Hi, Sandy.
Hi, what's your question?
Oh, yes. My question is, I have a 14-year-old cat that was diagnosed with an inner ear problem infection, and he was on his 4th round of antibiotics, which was Baytril. And as soon as he's done with the antibiotics, it seems to come right back again. Yeah. And my vet said that she won't prescribe any more antibiotics, that she wants to go in there, like put him on a mild sedative and go down his ear with a scope and look around. Is that recommended?
That is. And often with ear infections, they're very painful. We have to use sedation or even anesthesia to be able to get a good look and see, does he have a tumor in there? He's a 14-year-old cat. Does he have just a simple infection? Does he have a foreign body in there? You may even have to be looking at if they see that there is no eardrum or there's a problem in his middle or ear cavity. You may even be looking at doing some other imaging, such as an MRI or a CT of his skull, so they can actually look at those ear canals a little bit better and have some idea of what's going on in there. So I think this cat needs better diagnostics right now.
All right, Tracy in Middleton. Hi there, you're next. What's your question?
Hi, I have a 2-year-old golden doodle, and anytime she drinks water, she seems to vomit. And we've had to kind of monitor the amount that she gets each time, only a half a cup, or it comes back up.
Yeah, and it may just be that she just only can take a small amount in. If she's keeping food down, she's having no other issues, then I would just be doing what you're doing, just giving her small amounts at a time so she isn't like just drinking a lot. One of my dogs, Vanna, does the same thing. We'll just gorge on water and then, there's this puddle of saliva and water right on my dining room floor. So
Esty does that too.
I know.
He drinks so much.
So much so fast it comes back up.
Yeah.
All right, we're going to take a quick break. If you're on the line, stay there. We'll have more calls with Sandy right after this. Continue our questions with Sandy Sawchuk. We'll start with Julie in Stoughton. Hi, Julie. Julie, I got to persist. There we go. Hi, Julie, you there?
Yes, I'm here.
Okay, what's your question?
Well, I have 2 male cats. One is a year and a half, and the other one is 2.5 years old. And I usually feed them the Science Diet cat food. And someone at the vet told me I should still be giving them both the kitten cat food.
Well,
and I usually buy the light cat food because they're getting chunky.
Well, kitten food is usually a little bit higher in protein, much higher in energy and fat because you're trying to support growth of these little baby kittens. And as cats get older, they don't need as many calories. And so I totally disagree. I think that you really need to feed the cat what's appropriate calorie-wise, and usually a light diet would be an appropriate thing to consider using so they can eat a little bit more and still get all the nutrition they need as an adult cat. So Not sure why they were saying kitten food.
Yeah,
That's
like-
kind of a little odd, but
Light food would be a better idea.
I think so, especially for indoor neutered male cats.
Okay.
Yep.
All right. Thank you for calling. Let's go to Debbie in Darlington. Hi, Debbie. What's your question?
Hi, this is regarding guinea pigs and allergies. I am very allergic to guinea pigs, and a family member has a guinea pig, and they have actually sold it. And now I'm wondering when I can go back into their home without
Yeah.
becoming allergic to the dander or whatever that is.
Yeah. I know with cats, the protein that people are allergic to can stay in the environment for months and months. It's very, very, can live for a long time. So what I'd be recommending is that they perhaps use a HEPA filter vacuum, that you do not go into the room where the guinea pig happened to be, that you consider talking to your allergist, and here I'm like playing physician, but talking to your allergist to pre-medicate yourself, just because if you have very severe allergies, that could be potentially a problem. But kind of avoiding the area where the guinea pig was and having them make sure that they vacuum, and if they've got things that are washable, curtains or pillows or anything like that, get that stuff washed so that you get rid of the allergens that the guinea pig may have left behind.
All right, let's go to Laurie in Cambridge. Hi, Laurie. Laurie, you there?
Yes.
Hi, what's your question?
I have a question about our golden retriever. He has a lot of dry skin, it seems like, and he's always itching. I was wondering if there's a product to use for that.
Well, before you can recommend a product, you need a diagnosis, and there's lots of reasons why dogs itch. I had a golden retriever in the other day that has a very odd problem, but it's called ichthyosis, which stands for fish scale disease, and it's a common, I guess, a relatively common problem in Goldens. It's genetic, where they get lots of flaking and secondary infections and so on. So I think you need to really get a diagnosis rather than just trying to medicate, and it may mean visiting with a veterinary dermatologist so that they can do the appropriate test, taking some skin scrapings, looking at cytology under the microscope. Sometimes even doing a skin biopsy may be necessary to get the proper diagnosis. And with that, then you can choose the right shampoos, the right sprays, topical medications, and so on to make the dog more comfortable.
Could be allergies, could be a lot of things.
It could be a lot of things.
All right. We are out of time, unfortunately. Lots of good questions today.
Yeah. Thanks for your calls, everybody.
Yeah.
Good questions.
We'll see you in a month.
I'll be.
Thanks, Debbie. See you next time.
And we'll see you right after the break.